Welcome to our channel. Today, we're discussing the early signs of dementia that you should never ignore. Stay tuned to learn more and protect your loved ones. One of the earliest signs of dementia is memory loss, especially when it affects daily life. This isn't just about misplacing your keys or forgetting an appointment. This goes beyond the occasional forgetting of names or appointments. It can be much more pervasive and disruptive. We're talking about forgetting recently learned information, like a conversation you just had. Imagine not remembering a discussion you had moments ago. You might find yourself asking the same questions repeatedly, not because you didn't hear the answer, but because you simply can't remember it. This type of memory loss occurs because dementia affects the parts of the brain responsible for learning and memory. The brain's ability to store and retrieve information is compromised. As these brain cells deteriorate, their ability to communicate effectively is disrupted. This disruption leads to the confusion and forgetfulness often seen in dementia patients. It's crucial to consider other potential causes, such as stress, lack of sleep, or medication side effects. These factors can also contribute to memory issues and should not be overlooked. Consult a healthcare professional if you notice persistent or worsening memory problems. Early diagnosis and intervention can make a significant difference in managing the condition and improving quality of life. Another red flag for dementia is difficulty performing familiar tasks. These are activities that once came naturally and effortlessly, but now seem challenging and confusing. This could involve anything from preparing a meal, where following a simple recipe becomes a daunting task, to driving to a familiar location, where once familiar routes now seem like a maze. Imagine struggling to remember how to use the microwave, an appliance you've used daily for years, or getting lost on a route you've driven for years. Suddenly feeling disoriented in your own neighborhood. The areas of the brain affected by dementia play a crucial role in our ability to plan and execute these tasks. These regions are responsible for our cognitive functions, including memory, problem-solving, and attention. As these areas deteriorate, so does our ability to perform these activities smoothly. Simple tasks like buttoning a shirt or making a cup of tea can become overwhelming. It's important to differentiate between occasional forgetfulness, which can happen to anyone, and a consistent pattern of difficulty that disrupts daily life. If these difficulties become increasingly frequent and interfere with your daily routine, it's crucial to seek medical attention. Early intervention can make a significant difference. Early assessment and diagnosis are vital to rule out other potential causes and explore appropriate interventions. Timely medical advice can help manage symptoms and improve quality of life. We all experience those frustrating tip-of-the-tongue moments where a word seems just out of reach. However, for individuals in the early stages of dementia, problems with language can be more persistent and troubling. They might find it challenging to follow conversations or keep up with the flow of dialogue, often feeling lost or overwhelmed. Finding the right words to express themselves can become increasingly difficult, leading to frustration and social withdrawal. This difficulty with language stems from the impact of dementia on the brain regions responsible for language processing, such as the temporal and frontal lobes. Occasional word-finding difficulties can be a normal part of aging, but persistent issues may indicate something more serious. When these language problems become more frequent and affect daily communication, it is crucial to consult a healthcare professional for a thorough evaluation. Early evaluation can help determine the underlying cause and access available treatments, which may include speech therapy, medication, or other interventions to manage symptoms and improve quality of life. Disorientation to time and place is another common early sign of dementia. It goes beyond occasionally forgetting the day of the week. We're talking about losing track of dates, seasons, and the passage of time. Individuals might forget where they are or have difficulty finding their way back home. This disorientation stems from the impact of dementia on brain regions crucial for memory and navigation. While occasional forgetfulness about dates or directions can happen to anyone, persistent disorientation should not be dismissed. Consult a healthcare professional for proper evaluation. Early diagnosis is essential to rule out other potential causes and explore available treatment options. A significant decline in judgment can be a warning sign of dementia. This could manifest as making unusual financial decisions or neglecting personal hygiene. Individuals might fall victim to scams more easily or make decisions that seem out of character. These changes in judgment stem from the impact of dementia on the frontal lobe. As this area deteriorates, our ability to make sound decisions becomes compromised. While occasional lapses in judgment are normal, consistent changes warrant attention. Consult a healthcare professional to determine the underlying cause. Early diagnosis and intervention can help manage symptoms. Abstract thinking involves understanding and manipulating ideas and concepts. In the early stages of dementia, difficulty with abstract thinking can manifest in various ways. Individuals might struggle to manage finances or understand abstract concepts. These difficulties arise because dementia affects the brain's ability to process information. As the disease progresses, tasks that require abstract reasoning become increasingly challenging. Persistent changes in abstract thinking abilities should not be ignored. Consult a healthcare professional for a comprehensive evaluation. Early diagnosis and intervention can make a significant difference in managing symptoms. We all misplace things from time to time. However, for individuals in the early stages of dementia, misplacing things takes on a different dimension. It becomes more frequent and often involves putting things in unusual places. These instances reflect a disruption in the brain's ability to organize and recall information. Dementia affects the brain regions responsible for spatial memory. While occasional forgetfulness is normal, a persistent pattern of misplacing items should not be ignored. Consult a healthcare professional for a comprehensive evaluation. Early diagnosis and intervention can help manage symptoms. Significant and unexplained changes in mood or behavior can be a red flag for dementia. Individuals might experience rapid mood swings without any apparent trigger. These shifts can occur without any apparent trigger, leaving loved ones feeling confused. Dementia affects the brain regions responsible for regulating emotions and social behavior. As these areas deteriorate, individuals may have difficulty managing their emotions. Persistent and significant shifts, especially those that are out of character, warrant attention. Consult a healthcare professional for a comprehensive evaluation. Early diagnosis and intervention can help manage symptoms and provide appropriate support. Significant and unexplained personality changes can be a red flag for dementia. Individuals might become increasingly confused, suspicious, or withdrawn. They may lose interest in hobbies they once enjoyed or become socially isolated. Dementia affects various brain regions, including those responsible for personality and social behavior. As these areas deteriorate, an individual's core personality traits may gradually erode. Drastic and unexplained shifts, especially those accompanied by other cognitive changes, should not be ignored. Consult a healthcare professional for a comprehensive evaluation. Early diagnosis and intervention can help manage symptoms and provide appropriate support. A persistent and noticeable loss of initiative can be a warning sign of dementia. Individuals might lose interest in hobbies, social activities, or work. This loss of initiative can extend to everyday activities, making it challenging to maintain daily routines. Dementia affects various brain regions responsible for motivation and goal-directed behavior. As these areas deteriorate, individuals may find it difficult to initiate activities. A persistent decline in initiative, particularly when coupled with other cognitive changes, should not be ignored. Consult a healthcare professional for a comprehensive evaluation. Early diagnosis and intervention can help manage symptoms and maintain engagement. Thank you for watching. If you found this video helpful, please like, share, and subscribe to our channel. Early detection of dementia is crucial for providing the best possible care and support for individuals and their families.